Have you ever felt a little foggy or had moments where you just couldn't remember something that seemed so clear before? Maybe you've walked into a room and completely forgotten why you were there, or you've misplaced your keys for the third time this week. We all experience these lapses in memory occasionally, but what if they were more than just innocent forgetfulness? What if something you're taking every day could be silently affecting your brain health? Today, we're diving into a topic that isn't talked about nearly enough, but has the potential to impact millions of people. Medications that could increase the risk of serious dementia. That's right. Some of the very medications prescribed to help us might be doing more harm than good when it comes to our cognitive health. Dementia isn't just an inevitable part of getting older. It's a complex condition that involves a decline in memory, thinking, behavior, and the ability to perform everyday activities. While genetics and aging do play a role, many people don't realize that certain medications can significantly contribute to this decline. And these aren't obscure drugs that you've never heard of. They're commonly prescribed and often found in medicine cabinets around the world. In today's video, we'll reveal 7 medications that have been linked to an increased risk of dementia. These are drugs that you or someone you know might be taking right now, without realizing the potential risks to brain health. We'll explore why these medications are prescribed, how they affect the brain, and what you need to know to protect yourself and your loved ones. But don't worry, it's not all bad news. We're also going to talk about what you can do if you're currently taking one of these medications, or if you want to minimize your risk of cognitive decline. There are steps you can take to safeguard your brain health, and understanding the potential risks is the first crucial step. So if you're concerned about memory loss, dementia, or just want to ensure you're doing everything you can to keep your brain sharp, stick around. What we discuss today could change how you think about your health and the medications you take. Let's get started on this eye-opening journey to better understand how we can protect our minds and live healthier, longer lives. Proton pump inhibitors, or PPIs. Let's talk about something many of us have taken at one time or another: proton pump inhibitors, or PPIs. These are the go-to medications for millions of people suffering from acid reflux, heartburn, and GERD, gastroesophageal reflux disease. You might recognize some common names like Prilosec, lansoprazole, Prevacid, and esomeprazole, Nexium. These drugs work by reducing the amount of acid produced in your stomach, giving you relief from that burning sensation and discomfort. Sounds like a lifesaver, right? But what if I told you that these seemingly harmless pills could be doing more than just soothing your stomach? Recent research has raised some concerning questions about the long-term use of PPIs and their potential impact on brain health, specifically the increased risk of developing dementia. Here's where it gets interesting and a little alarming. Studies suggest that prolonged use of PPIs might interfere with the absorption of vitamin B12, an essential nutrient for maintaining healthy brain function. You see, stomach acid is crucial for absorbing vitamin B12 from the foods we eat. When you take PPIs, the reduction in stomach acid means less vitamin B12 gets absorbed. Over time, this deficiency can lead to cognitive decline and other neurological problems. But that's not all. PPIs also have a significant impact on the gut microbiota, the trillions of bacteria living in our intestines that play a key role in everything from digestion to immune function and even brain health. By altering the balance of these gut bacteria, PPIs may disrupt the gut-brain axis, complex communication network that links our gut to our brain. Changes in this system have been linked to several neurodegenerative diseases, including dementia. So, while PPIs are effective for treating heartburn and acid reflux, there's a potential trade-off that many people don't know about. It's not to say you should stop taking them altogether. Sometimes they are necessary for managing serious digestive conditions. However, it's crucial to be aware of the potential risks, especially if you're using them long-term. Always consult with your healthcare provider about the best course of action for your health. In summary, PPIs like omeprazole can be a quick fix for acid reflux, but they might also be playing a longer game with your brain health. It's all about balance and being informed about what we put into our bodies. So, before you reach for that bottle, consider having a conversation with your doctor about the potential risks and whether there are safer alternatives for managing your symptom. Your brain will thank you. Anticholinergics. Let's dive into a group of medications that you might not have heard much about but could have a big impact on your brain health. Anticholinergics. These medications are widely used to treat a variety of conditions, from overactive bladder and allergies to Parkinson's disease. On the surface, they seem like helpful solutions to some common problems. But what if I told you that these medications might be putting your cognitive health at risk? Here's the deal. Anticholinergics work by blocking the action of acetylcholine, a neurotransmitter that plays a critical role in transmitting signals in the brain and throughout the nervous system. Acetylcholine is particularly important for memory and learning. Think of it like the brain's communication network, helping neurons talk to each other, allowing you to remember where you left your keys or recall a loved one's face. Now, while blocking acetylcholine can help alleviate symptoms of certain conditions, it can also lead to some unintended consequences. By disrupting this vital communication in the brain, anticholinergics can cause side effects like drowsiness, confusion, and blurry vision. But more concerning is the growing body of research suggesting that long-term use of these medications is associated with an increased risk of cognitive decline and dementia. Let's break this down a bit further. Studies have shown that older adults who take anticholinergic medications regularly have a significantly higher risk of developing dementia compared to those who don't. This risk is particularly elevated with prolonged use or higher doses. The brain changes associated with anticholinergic use resemble those seen in Alzheimer's disease, which is the most common form of dementia. This means that, over time, these drugs might be doing more harm than good when it comes to our brain health. Some common anticholinergic medications include those used for treating bladder problems, like oxybutynin, and certain allergy medications, like diphenhydramine, found in over-the-counter sleep aids and allergy meds. Even some medications for depression, like certain tricyclic antidepressants, anticholinergic properties. The problem is that many people aren't aware of the cognitive risks associated with these drugs, as they are often seen as benign or necessary for managing symptoms. So what can you do if you or someone you know is taking anticholinergic? First step is awareness. It's crucial to know what medications you're taking and understand their potential side effects. If you're concerned about the cognitive risks, talk to your healthcare provider. They might be able to recommend alternative treatments with fewer cognitive side effects, or they might suggest strategies to minimize your exposure to these drugs. Remember, all about balancing the benefits and risks. These medications can be helpful for treating specific conditions, but they shouldn't come at the cost of your brain health. By being informed and proactive, you can make decisions that help protect your cognitive function and keep your mind sharp for years to come. Corticosteroids. Let's talk about a class of medications that many of us have encountered, especially if we've dealt with inflammation or autoimmune conditions. Corticosteroids. Drugs like prednisone and dexamethasone are commonly prescribed for a variety of conditions, ranging from asthma and allergies to arthritis and lupus. These medications are incredibly powerful in reducing inflammation and suppressing the immune system, making them vital tools in the treatment of many diseases. But like any powerful tool, they come with a set of risks that aren't always well understood. Corticosteroids mimic the effects of hormones your body produces naturally in the adrenal glands, which sit on top of your kidneys. These hormones, like cortisol, play a crucial role in managing stress, reducing inflammation, and regulating the immune response. When you take corticosteroids, you're essentially boosting these natural processes, which can be a lifesaver when your body is overreacting due to an autoimmune disorder or severe inflammation. However, there's a catch. When taken over a prolonged period, corticosteroids can start to affect more than just your inflammation levels. One of the lesser-known but increasingly concerning side effects is their impact on the brain. Long-term use of corticosteroids has been linked to structural changes in the brain. What does that mean? It means that these medications can actually alter the way your brain looks and functions, leading to cognitive impairment, mood swings, and in some cases, even dementia. Here's how it works. Prolonged exposure to high levels of corticosteroids can affect the brain's hippocampus, which is the area responsible for memory and learning. Corticosteroids can cause a reduction in the size of the hippocampus, leading to memory problems and difficulties with cognitive function. This shrinkage can make it harder to remember things, learn new information, and even concentrate on everyday tasks. Over time, these changes can contribute to more severe cognitive decline and an increased risk of dementia. But that's not all. Corticosteroids also influence other areas of the brain that regulate mood and emotional response, which can lead to mood swings, anxiety, and depression. For some people, these effects can be temporary, but for others, especially those on long-term corticosteroid therapy, the impact can be more lasting and severe. It's important to remember that corticosteroids can be essential for managing certain health conditions, and sometimes their benefits outweigh the risks. However, it's crucial to be aware of these potential side effects, especially if you're prescribed these medications for a long duration. If you or someone you know is taking corticosteroids, it's worth having a conversation with a healthcare provider about the risks and exploring whether there are alternative treatments or strategies for minimizing exposure. In conclusion, while corticosteroids are powerful medications that can greatly improve quality of life for many, they are not without their downsides. Understanding the potential cognitive risks associated with prolonged use is key to making informed decisions about your health. Always be proactive about discussing your treatment options and finding the safest, most effective path for your wellness journey. Benzodiazepines. Let's talk about a class of medications that many people rely on for relief from anxiety and insomnia. Benzodiazepines. You might know them by some of their common names, like diazepam, Valium, lorazepam, Ativan, or alprazolam, Xanax. These drugs are well known for their calming effects, helping to ease the mind and relax the body when stress or sleeplessness takes over. But what if these medications, while effective in the short term, come with some serious long-term consequences for your brain health? Benzodiazepines work by enhancing the effects of a neurotransmitter called gamma-aminobutyric acid, GABA, which helps to reduce brain activity and produce a tranquilizing effect. This can be incredibly helpful when you're feeling overwhelmed, anxious, or unable to sleep. However, the same mechanism that makes benzodiazepines effective in calming the nervous system can also have unintended effects on the brain, especially when these drugs are used over long periods. Research has shown a concerning link between long-term benzodiazepine use and an increased risk of Alzheimer's disease and other forms of dementia. How does this happen? It appears that prolonged use of benzodiazepines can lead to changes in the brain that mimic the effects of aging and cognitive decline. Over time, these medications can interfere with the brain's ability to form and retrieve memories, leading to a gradual loss of cognitive function. One of the reasons for this is that benzodiazepines affect the hippocampus, part of the brain that plays a crucial role in memory formation and spatial navigation. Regular use of these drugs can cause the hippocampus to shrink, impairing its function and leading to symptoms like confusion, forgetfulness, and difficulty concentrating. This isn't just about losing your keys or forgetting a name. It's about a deeper, more profound impact on how you think and remember, which can significantly reduce your quality of life over time. Moreover, studies have suggested that people who use benzodiazepines for extended periods may have up to a 50% higher risk of developing Alzheimer's disease compared to those who do not use these medications. This is a significant increase, highlighting the importance of considering the long-term effects when deciding whether to use benzodiazepines. So, what does this mean if you or someone you know is taking these medications? It doesn't necessarily mean you should stop them immediately, but it does mean you should have a conversation with your healthcare provider. There may be alternative treatments or strategies to manage anxiety and insomnia, carry fewer risks for your brain health. In conclusion, while benzodiazepines can offer short-term relief, it's crucial to be aware of the potential long-term effects on cognitive function and memory. Understanding these risks can help you make informed decisions about your health and explore safer options to manage anxiety and insomnia without compromising your brain. Amphetamines. Let's talk about a class of medications that have become incredibly common, especially among children and adults dealing with attention deficit hyperactivity disorder, ADHD. Amphetamines. You've probably heard of Adderall, one of the most widely prescribed amphetamines, used to help those with ADHD manage symptoms like inattention, hyperactivity, and impulsivity. For many, these medications are game changers, enhancing focus and concentration and allowing people to function more effectively in their daily lives. But what if there's more to the story than just improved focus? Amphetamines work by increasing the levels of certain neurotransmitters in the brain, like dopamine and norepinephrine, which help regulate mood, attention, and behavior. This boost can help people with ADHD feel more alert, reduce impulsive behaviors, and improve their ability to concentrate on tasks. In the short term, the effects of amphetamines can be quite beneficial, providing much-needed relief from the challenges of ADHD. However, what many people don't realize is that prolonged use of these medications can come with significant risks, especially when it comes to brain health. Studies have shown that long-term amphetamine use may lead to memory loss and other cognitive issues. How does this happen? Well, amphetamines can cause changes in the brain's structure and function over time, particularly in areas involved in memory, learning, and decision-making. One of the primary concerns is that amphetamines can lead to neurotoxicity, which is when nerve cells in the brain are damaged or destroyed. This damage can occur because amphetamines increase dopamine levels in the brain to such a degree that it can become harmful. Over time, this can affect the brain's ability to communicate effectively, leading to difficulties with memory, learning, and even emotional regulation. Moreover, some research suggests that long-term use of amphetamines may reduce the brain's natural production of dopamine, which can lead to dependency and make it harder for the brain to function normally without the drug. This can result in a cycle where increasing doses are needed to achieve the same effects, further escalating the risk of cognitive decline and other mental health issues. So, what does this mean if you or someone you know is taking amphetamines for ADHD? It's important not to panic, but to be informed. These medications can be very effective when used appropriately and under the supervision of a healthcare provider. However, if you're concerned about the potential long-term effects, it's worth having a conversation with your doctor. There may be other treatment options available or strategies to mitigate the risks associated with long-term use. In conclusion, while amphetamines like Adderall can be helpful for managing ADHD symptoms, it's crucial to understand the potential cognitive risks of prolonged use. Staying informed and working closely with your healthcare provider can help you make the best choices for your brain health and overall well-being. First-generation antihistamines. Let's talk about a type of medication that's probably sitting in your medicine cabinet right now. First-generation antihistamines. These drugs are commonly used to treat allergies, colds, and even insomnia. You might recognize some familiar names like diphenhydramine, which is the active ingredient in Benadryl, and many over-the-counter sleep aids. While these medications can provide quick relief from sneezing, runny noses, and itchy eyes, there's something you might not know about them. They can have a surprising impact on your brain health, especially if used frequently or over a long period. First-generation antihistamines work by blocking the action of histamine, a substance in your body that causes allergic symptoms. But here's where things get interesting. These drugs also have strong anticholinergic effects. This means they block another crucial neurotransmitter called acetylcholine, which plays a vital role in memory and learning. Acetylcholine is like a messenger that helps brain cells communicate with each other, keeping your mind sharp and your memory intact. When you take first-generation antihistamines, you're not just stopping your allergy symptoms, you're also blocking acetylcholine. This can lead to a range of side effects, including drowsiness, confusion, and blurred vision. But perhaps more concerning is the long-term impact these drugs can have on your brain. Research has shown that regular use of first-generation antihistamines can impair memory and increase the risk of cognitive decline and dementia over time. Studies have found that older adults who take these medications frequently, or for extended periods, are at a significantly higher risk of developing dementia compared to those who do not. The risk is particularly concerning because these medications are often available over the counter, leading many people to use them without fully understanding the potential consequences. So what can you do if you rely on these medications to manage your allergies or sleep? First, it's important to be aware of the potential risks associated with long-term use of first-generation antihistamines. There are safer alternatives, such as second-generation antihistamines like loratadine, Claritin, and cetirizine, Zyrtec, which have fewer anticholinergic effects and are less likely to impact your memory or cognitive health. If you're taking a first-generation antihistamine regularly, consider discussing with your healthcare provider whether a different medication might be better suited for you, especially if you are concerned about your cognitive health. Small changes in your medication choices can make a big difference in protecting your brain and preserving your memory. In conclusion, while first-generation antihistamines like diphenhydramine can be effective for treating allergies, it's crucial to understand their potential impact on brain health. Being informed and proactive about the medications you use can help you make the best decisions for your cognitive well-being. Tricyclic antidepressants. Today, let's talk about a class of medications that have been around for quite a while and are still prescribed to many people today. Tricyclic antidepressant. You might have heard of names like amitriptyline, Elavil, or nortriptyline, Pamelor. These medications were some of the earliest developed to treat depression and have also been used for conditions like chronic pain and insomnia. But while they can be effective for some, there's an important aspect of these drugs that we need to discuss: their impact on brain health. Tricyclic antidepressants, TCAs, work by affecting the levels of neurotransmitters in the brain, such as serotonin and norepinephrine, which help regulate mood. However, what many people don't realize is that these medications also have significant anticholinergic properties. This means they block the action of a neurotransmitter called acetylcholine, which is crucial for memory, learning, and cognitive function. Acetylcholine acts like a messenger in the brain, helping neurons communicate with each other. It plays a vital role in processes like forming new memories and retrieving old ones. When tricyclic antidepressants block acetylcholine, they can interfere with these brain functions. In the short term, this can lead to side effects like dry mouth, blurred vision, constipation, and drowsiness. But over the long term, especially in older adults, these drugs can contribute to cognitive decline and memory loss. Research has shown that the prolonged use of tricyclic antidepressants, particularly in older adults, can lead to a higher risk of developing dementia. The anticholinergic effects of these drugs can accelerate the decline in cognitive abilities, making it harder to remember things, learn new information, and perform everyday tasks. For older adults who may already be experiencing some age-related cognitive changes, the use of TCAs can exacerbate these issues, leading to a faster decline in memory and other cognitive functions. So, what does this mean if you or someone you know is taking a tricyclic antidepressant? It's essential to be aware of these potential risks, especially if there are concerns about memory or cognitive health. If you're worried about the impact of these medications, it's worth having a conversation with your healthcare provider. There are newer classes of antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, and serotonin and norepinephrine reuptake inhibitors, SNRIs, which typically have fewer anticholinergic effects and may be a safer option for managing depression without compromising cognitive function. In conclusion, while tricyclic antidepressants can be effective for treating certain conditions, crucial to weigh the benefits against the potential risks, particularly regarding brain health. Understanding the impact of these medications on cognition can help you make informed decisions and protect your memory and cognitive function for years to come.